Bismillahirrahmanirrahim. I'm Dr. Nadia Awais, Associate Professor Gynae. Today is your first online gynecological interaction and we are going to discuss infertility. Infertility is the second commonest cause for which women of childbearing age see their gynecologist. What we need to learn at the end of this interaction is the definition of infertility, its types, the prerequisites required for normal fertilization, etiology of infertility, how to investigate it, and to give optimal management to your patient. Now, starting with the definition, infertility is defined as failure of a couple to conceive after 1 year of regular coitus without contraception. You can see in this definition it has two parts. One is the duration of 1 year and second is a coitus without contraception. So the couple who are living for 1 year together and having regular coitus without contraception are candidates of infertility. It has two types. It would be labeled as primary infertility, the couple who have never conceived. Secondary infertility, the couple who have previously conceived irrespective of the outcome. For example, they can end up with the ectopic pregnancy or a miscarriage, but if they have previously conceived, they are categorized as secondary infertility. The incidence of infertility varies from 7 to 15% of the couple because about 80% of the couple they conceive after 1 year of regular unprotected sexual intercourse. Female and male fertility declines significantly with the age. Now this slide shows the prerequisites required for normal fertilization. You should keep that in mind because if there is a problem at any level of the normal prerequisites, it can end up with infertility. Now this includes a regular ovulation with good quality ovum, patent fallopian tubes, receptive cervical mucus, good quality semen, ability of husband to deposit semen into vagina, and a normal endometrial cavity for implantation. The normal axis for successful reproduction need proper structure and function of this reproductive axis, which starts from hypothalamus to pituitary glands to ovaries. This interaction results in formation of the ovum and a patent fallopian tubes, and finally vagina, cervix and uterus tract should be patent for the travel of the sperm to the ovum, and finally a fertilized ovum need a receptive uterine cavity for implantation. Now, keeping the normal prerequisites of fertility in your mind, you can memorize easily where the problem can start and it can result in a etiology of infertility. There are three major groups of etiology. The first is the female group, which can be a cause of infertility in 40% of the cases. Second is the male group. There are 30% chances that the cause of infertility would be a male in the couple. And the third group is the unexplained category, which covers 25% of the candidates. Why we call it as unexplained? Because you wouldn't find anything as a problem in male and the female to cause infertility. Now, looking into the slide further, the female are further categorized into ovulatory, tubal, uterine, cervical, and endometriotic causes of infertility. Now this is the slide which shows the further causes of anovulation or the anovulatory disorder. WHO categorized the anovulation into three major groups. The first group is the hypothalamic pituitary failure. It is a cause of anovulation in 10% of the women who are having problem of anovulation. On the biochemical characteristics, there would be low gonadotropin level, the prolactin level would be normal, and the estrogen level would be low. The second group include hypothalamic pituitary dysfunction. Maximum cause of anovulation in a female would come under this category. The biochemical presentation would be as a gonadotropin and estrogen level usually are normal. The third category is the ovarian failure category, in which the gonadotropin level would be high and the estrogen level would be low. There is a fourth category which can fairly cause an ovulation, that is hyperprolactinemia. The elevated prolactin level would be there on investigation and there would be a reduced gonadotropin level. Now, if you go in bit more detail as a cause of an ovulation, the causes of hypothalamic pituitary failure would be congenital or it could be acquired. This is difficult to treat because it can be due to congenital problem like Kahneman syndrome. If it is an acquired cause, it can be due to pituitary tumor, pituitary necrosis, stress, exercise, excessive weight loss. So 10% of the people who are having an ovulation, they would have hypothalamic pituitary failure. The second cause is the hypothalamic dysfunction, and it is the maximum number of the people who are having an ovulation due to this underlying pathology. The problem would be polycystic ovarian syndrome. It is a treatable cause of ovarian dysfunction, and diagnosis is made by presence of 2 out of the 3 Rotterdam criteria, which includes oligomenorrhea as a clinical presentation. There can be polycystic ovaries, or it can be a clinical or biochemical evidence of hyperandrogenism. Now this is a picture which beautifully presents how the different number of follicles you can see in the ovaries. By definition, if the ovary is having 12 or more follicles of 2 to 9 mm in diameter and increased ovarian volume of 10 cm cube, it will be labeled as polycystic ovaries. Now this picture, it gives a presentation of hirsutism, which is a clinical presentation of hyperandrogenism. Hyperandrogenism can also be due to some other causes like Cushing syndrome, adrenal tumor, or 21 hydroxylase deficiency, which you can find out by further investigation. Now the third cause of anovulation is the ovarian failure. Ovarian failure is a very small group of people as an ovulation, about 4 to 5%. It can be due to the genetic causes like Turner syndrome. It can be due to the acquired problem like exposure to chemotherapy or the radiotherapy, or simply due to some autoimmune ovarian failure. Now hyperprolactinemia, the prolactin secretion is regulated by inhibitory effect of dopamine from hypothalamus and is stimulated by peripheral estrogen. Increased prolactin level will cause decrease in gonadotropin. When there would be a decreased gonadotropin available, there would be reduced estrogen amount and there would be anovulation. Causes can be idiopathic, formation of some prolactinoma. It can be due to some pharmacological agents like antipsychotics, antiemetics. They can cause raised level of prolactin and subsequently anovulation. The patient can have primary hypothyroidism, and as a feedback mechanism, there will be a raised level of prolactin and subsequently anovulation. Now the second cause of female infertility is the tubal factor infertility. Tubal factor infertility can be due to some pelvic infection. The commonest in organism include chlamydia and gonorrhea. It can be due to pelvic surgery, which can cause tubal damage or adhesion, or simply by sterilization, for your understanding, as tubal ligation. There are certain other causes like fibroids, which can cause disruption in the endometrial cavity for implantation, or it can even block the track towards the tube. There can be endometriosis, a pathology in the peritoneum, Mullerian developmental structure anomalies. There can be septum in the vagina, and the sperm wouldn't get any way towards the uterine cavity and all the way to the tubes. So these are the different causes which can cause infertility. Endometriosis is the presence of endometriotic tissue at places other than the endometrial cavity. It causes increased release of macrophages and prostaglandin F2 alpha, which causes infertility by the mechanism of sperm phagocytosis, ovarian dysfunction, tubal function damage by structure and functional damage, and changes in the peritoneal fluid environment, which is not a effective place for the fertilized ovum, and finally there wouldn't be any conception. Now this is a picture which shows the presence of endometriotic spot over the ovaries as the dark brown spots, and on the other side the ovaries increase in size, and that is an endometrioma. Now this we will see the second major cause of infertility is the male factor infertility. Again, it can be due to the genetic causes like Klinefelter syndrome, cryptorchidism, orchitis, varicoceles, occupational or environmental factors, genital tract obstruction, congenital bilateral absence of vas deferens. These all factors they can cause infertility. The last category, the last major cause of infertility is the unexplained group. We call it as unexplained group. They are on being investigation. While you are going to investigate the male and the female, you wouldn't find any pathology in either of them, so we will label them as a unexplained infertility category. 10 to 15% of the couple would have no explanation of their infertility, and the underlying pathology would be just simply labeled as they are unexplained group of people. So this is for today. What we have gone through in this interaction was the definition of infertility, which was inability of a couple to conceive after 1 year of regular coitus without contraception. It can be primary, it can be secondary. There are certain normal prerequisites for fertilization, which needs a good quality ovum, patent fallopian tubes, and receptive cervical mucus for the sperm, and finally a endometrial cavity for implantation of that fertilized ovum, and the male good semen sample, and the ability of the male to deposit that semen into the vagina. Then the etiology of infertility, it is categorized into major 3 groups. The female group, which has further problems like anovulatory problem, tubal problem, or problem in the uterine cavity, cervix, or the peritoneum in form of endometriosis. It can be a male cause of infertility as a second major cause, or the third major cause is the unexplained infertility. We will continue in the next lecture with the investigations of infertility and the optimal management for the couple, so to increase the chances of conception and a better outcome. Thank you for today. See you. Thank you very much.